More than 1 in 3 people over 60 develop a noticeable forward curve in their upper spine, and that hunch can steal breath, mobility, and the confidence to move freely. Left unchecked, it leads to daily neck and back pain, shorter stride, and even trouble reaching overhead. The good news: gentle, targeted core and upper back exercises can ease pain, open your chest, and lift your posture without hours in the gym. First, I'll guide you through a simple, safe routine you can do in 10 to 15 minutes, moves that strengthen the deep core, mobilize the thoracic spine, and retrain your shoulders to sit where they belong. You'll see exactly how to modify each exercise for stiff joints, how often to practice, and quick posture cues to use while standing, walking, or sitting. By the end, you'll be able to fold these habits into morning routines and TV time so progress becomes effortless. Stay with me and follow along. Try the first 2 gentle exercises now, and feel the difference in your breath and balance within minutes. If you want pain-free days and a stronger, taller posture after 60, this is the plan that actually works. Understanding age-related spinal changes. Spines change with age in predictable ways that influence posture, balance, and everyday comfort. Discs lose hydration and height over time, which reduces the spine's natural shock absorption and narrows the space between vertebrae. When the disc can no longer bear load evenly, the facet joints pick up the slack and develop arthritic changes. Pain often follows. Bone becomes less dense in many people, especially postmenopausal women, and that loss of mineral strength raises the risk of vertebral compression fractures that can create a forward, wedge-shaped collapse in the thoracic spine. Small structural shifts lead to visible postural differences. Thoracic kyphosis, an exaggerated rounding of the upper back, is common, and it pulls the head and shoulders forward, increasing strain on neck muscles and changing shoulder mechanics. Muscles matter too. Age-associated sarcopenia reduces the size and force of spinal extensors, core stabilizers, and gluteal muscles, so the active support system that keeps the spine upright becomes weaker. Ligaments and joint capsules stiffen, which limits spinal mobility and makes it harder to reverse a stooped position. Mechanical consequences are practical and measurable. Reduced disc height alters spinal alignment and can contribute to foraminal narrowing, which may irritate nerve roots and create shooting pain or numbness. Thickening of ligamentous tissue like the ligamentum flavum, combined with facet hypertrophy, can reduce central canal space and cause symptoms of spinal stenosis during walking or standing. Lung volumes can be modestly limited by marked kyphosis, making deep breaths feel shallower and reducing endurance for daily chores. Simple tasks feel harder when the center of gravity shifts forward and balance is compromised. Understanding these changes points directly to what to prioritize. Strengthening the posterior chain, spinal extensors, scapular retractors, and glutes, supports the spine against flexion deformities, while preserving or improving thoracic mobility helps reclaim upright alignment. Bone health matters alongside muscle. Screening for low bone density and addressing risk factors can prevent or limit compressive fractures that make kyphosis worse. Practical examples include working on controlled spinal extension through gentle mobility drills, progressively loading the hip extensors with safe resistance, and integrating balance practice to reduce fall risk. Seek professional guidance when there is a history of fragility fractures, new or worsening neurological symptoms, or significant pain. Make small, consistent changes that reflect this anatomy and these mechanisms. Break up long periods of sitting, practice thoracic extension cues during daily activities, and prioritize exercises that emphasize posterior chain strength and postural endurance rather than only stretching. Talk with your healthcare provider about bone density testing if you have risk factors, and consult a physical therapist to translate the spine's structural picture into a personalized, safe program. Start with awareness. Then act. Activating deep core muscles. Weakness and poor timing of the deep core muscles, especially the transversus abdominis, the multifidus, the pelvic floor, and the diaphragm, often lets the upper body drift forward and the shoulders round, which increases load on the spine and can make standing upright feel tiring. Many people over time lose the automatic, protective activation of these muscles. The result is a posture that relies on surface muscles instead of the stabilizers closest to the spine. This change is not about willpower. It's about retraining muscle activation and breathing patterns that have become habitually shallow. Start with breathing. Lie on your back with knees bent and feet flat, or sit upright if lying down is uncomfortable. Place one hand on the chest and one on the belly to feel the difference. Inhale through the nose so the belly rises under your hand while the chest stays relatively calm. Exhale slowly through pursed lips, and on the out-breath gently draw the lower belly toward the spine. Think of closing a small zipper from pubic bone to navel, while keeping the ribcage relaxed. That small inward movement engages the transversus abdominis without bracing or holding your breath. Try to coordinate the pelvic floor by adding a very subtle lift, the same feeling as briefly stopping the flow of urine. Do not practice during urination. Breathe continuously. Never clench. Progress from breathing into simple movement. From the same supine position, perform controlled heel slides. Inhale to prepare. Exhale as you slide one heel away along the mat, maintaining the gentle belly draw and neutral spine. Then inhale as you return. Keep the lower back softly anchored to the surface. When that feels steady, advance to a dead bug, arms reach to the ceiling, hips and knees bent. Exhale while you lower one arm past your ear and the opposite leg toward the mat, keeping that tiny abdominal draw and a stable pelvis. Short repetitions with perfect control beat rushed sets. For those who prefer a hands-on cue, a gentle fingertip press into the lower belly provides feedback that the deep core stayed active. Move training into all fours and then into standing to make it functional. On hands and knees, practice the bird dog. Inhale to prepare. Exhale as you extend the opposite arm and leg until you feel a long line from fingertips to heel, and then return with control. Keep the ribs over the pelvis. When you stand, rehearse engaging the deep core before lifting a grocery bag or reaching overhead. Exhale and draw the lower belly lightly in as you prepare to move, then breathe normally while maintaining that low-level support. Balance and gait improve when the diaphragm and pelvic floor coordinate with the transversus abdominis and multifidus. The body becomes better at resisting the forward fold that causes a rounded upper back. Common mistakes to avoid are many but simple. Don't substitute a maximal abdominal crunch or hard bracing for the subtle, endurance-focused activation needed here. Big crunches fatigue surface muscles and don't train timing. Avoid breath holding. Each contraction should be synchronized with a calm breath pattern. Watch for over-tilting the pelvis or gripping the glutes so hard that the spine rounds more. If lower back pain increases or leg symptoms appear, pause and seek guidance from a physical therapist who can assess movement patterns and provide tailored progressions. Integrate these cues into daily life with short, consistent practices. A minute of diaphragmatic breathing while seated, 3 controlled heel slides before getting out of bed, and a set of bird dog reps while waiting for the kettle to boil will cement better timing without demanding long workouts. Small, frequent repetitions train the nervous system more than occasional intense sessions. Commit to practicing the coordination of breath, pelvic floor, and transversus abdominis each day, and then layer in functional tasks, standing from a chair, carrying a shopping bag, or reaching for a shelf, while keeping that subtle support engaged. Try a brief routine now. Lie or sit comfortably, take several diaphragmatic breaths with the belly hand feedback. Add a gentle pelvic floor lift on the exhale, then perform a few controlled heel slides or dead bug reps while maintaining the draw-in. If you feel unsure, ask a qualified clinician for a demonstration and individualized cues so you can practice safely and confidently. Small, consistent rewiring of these deep muscles often translates into easier upright posture and fewer pain-filled days. Simple scapular retraction moves. The scapulae are designed to glide over the ribcage, and they rely on coordinated muscle activation to keep the shoulders back and the upper spine aligned. When the shoulder blades sit forward and separated from the spine, a pattern called protraction, neck and upper back strain become common complaints. Poor sitting posture, long periods of forward-looking tasks, and reduced scapular mobility all contribute to this, making simple retraction work an efficient first step toward relief. One effective solution is to teach the scapulae to move independently of the arms. Retracting the scapulae trains the middle trapezius and rhomboids to oppose the forward pull of the chest muscles, restoring a more neutral shoulder position and reducing the load on the cervical spine. This is not about flexing the biceps or shrugging the shoulders, it's about a short, controlled squeeze between the shoulder blades that can be practiced anywhere. Start with a basic seated scapular squeeze. Sit tall, feet grounded, hands resting on your thighs. Without bending the elbows or lifting the chest, draw the shoulder blades straight back and toward each other as if you were trying to pinch a small object between them. Hold that gentle squeeze for a breath or two, then release slowly. Keep the chin level and avoid lifting the shoulders toward the ears. Another useful variation is the wall slide. Stand with your back and arms against a wall in a W shape, then press the forearms into the wall and slide them upward while consciously drawing the scapulae down and toward the spine. Maintain contact through the whole movement. For those with access to a resistance band, anchor it at chest height and perform slow, banded rows that begin with a scapular pull. Initiate each row by retracting the shoulder blades first, then finish the movement by bending the elbows and bringing the hands toward the ribs. Prone Y&T raises on the floor or on a bench are excellent for people who can lie face down. Lift the arms overhead into a Y or out to the sides into a T, focusing solely on the shoulder blades moving together without letting the neck do the work. Pay attention to quality rather than quantity. Short holds and deliberate activations beat fast, sloppy repetitions. Common mistakes include shrugging up toward the ears, allowing the ribs to flare, and using momentum from the arms instead of the powered squeeze of the scapular muscles. A helpful tactile cue is to place a rolled towel or small ball between the shoulder blades to feel the approximation. A visual cue is to imagine tucking the shoulder blades into your back pockets. If you feel sharp pain, numbness, or tingling that radiates beyond the shoulder region, stop and consult a clinician before continuing. Integrate these moves into your day with micro-practice, during short standing breaks, after sitting for long stretches, or paired with breath work to reinforce the motor pattern. Combine scapular retractions with gentle thoracic extension and core engagement for better posture carryover. Think of the shoulder blades setting a stable platform while the spine lengthens. If progress stalls, a physical therapist can assess muscle imbalances and suggest targeted progressions. Try choosing one simple retraction cue and using it consistently. Small, deliberate practice leads to more comfortable movement and fewer pain-filled days. Gentle daily stretching routine. Spinal mobility often decreases with age, and muscles that once kept you upright can become shorter or weaker, so a subtle forward curve becomes more likely and daily tasks get harder. Tight chest muscles pull the shoulders inward. Weak thoracic extensors fail to counterbalance that pull. The result is more neck and upper back pain, shallower breathing, and less ease reaching overhead. A gentle daily stretching routine targets those specific tight spots and brings balance back without strain. Start with 5 to 10 minutes on day 1 and gradually increase to about 10-20 minutes as you feel more comfortable. Move slowly, breathe deeply, and stop if sharp pain occurs. Mild stretching discomfort is okay, but pain is a warning. If you have osteoporosis, recent fractures, or uncontrolled medical issues, check with a healthcare professional before beginning. Begin with a standing chest opener. Place your forearms on either side of a doorway at shoulder height, step 1 foot forward, and gently lean through the opening until you feel a stretch across the front of the chest and shoulders. Hold 20-30 seconds and repeat twice. Follow with seated thoracic rotations to free the mid-back. Sit tall in a chair, cross your arms over your chest, rotate your torso to the right until you feel movement through the ribs, hold 2 seconds, then return and repeat to the left. Aim for 8-10 slow repetitions. Cat-cow mobilizations are excellent for spinal mobility, on hands and knees, or seated. Hands on knees, inhale to arch the back and look up, exhale to round the spine and tuck the chin. Perform 8-12 cycles with smooth, coordinated breathing. Add scapular squeezes to strengthen the muscles that retract the shoulder blades. Sit or stand tall and squeeze the shoulder blades together gently, holding for 3 seconds. Repeat 10-15 times. Wall angels help retrain upright shoulder mechanics. Stand with your back against a wall, arms bent in a goalpost shape. Slide arms up and down the wall with slow control for 6-10 reps. For hip tightness that contributes to pelvic tilt, perform a gentle kneeling hip flexor stretch. Kneel on one knee with the other foot forward. Tilt the pelvis slightly under and feel a stretch in the front of the hip. Hold 20-30 seconds per side. For those with limited mobility, every movement above has a seated or supported option. Do thoracic rotations while seated and use a rolled towel or small pillow between your shoulder blades while reclining to encourage gentle extension. If knees hurt, perform hip stretches standing with support, or try a modified child's pose with a bolster under the chest to avoid deep knee bending. Focus on diaphragmatic breathing throughout. Inhale through the nose to expand the belly and ribcage. Exhale slowly through the mouth while gently engaging the core. 5 slow breaths between stretches helps relaxation and better range of motion. Integration is simple. Tie the routine to an existing habit, like right after you brush your teeth or when you wake up, and do a quick set after long periods of sitting. Short bursts during TV commercial breaks work well too. Track how you feel in a notebook. Note easier reaching or reduced neck tension. Progress gradually. Add repetitions or a longer hold as your mobility improves, and combine stretching with daily walking for better overall results. Start small and be consistent. Try committing to a short sequence every day for 2 weeks, pay attention to how your posture and pain levels respond, and consult a physiotherapist if stiffness or pain persists. Small, regular stretches can change how your body moves and how you feel. Ergonomic tips for sitting and standing. Rounded shoulders and a forward head are common complaints after 60, often caused by years of leaning into screens, weakened thoracic muscles, and tighter chest tissues. These postural changes don't just look different, they compress the upper back, make breathing shallower, and can turn ordinary tasks into sources of pain. Left uncorrected, a habitual slump position trains muscles to accept the hunched alignment as normal. Short sentence for emphasis. Start by making the chair and workstation work for your body rather than forcing your body to fit the furniture. Small ergonomic shifts reduce strain immediately and help retrain muscle memory over time. Think of adjustments as corrective cues, they remind your spine how to stack itself comfortably. Simple tools like a lumbar roll, a monitor riser, or a sit-stand desk can make a measurable difference in daily comfort. When sitting, aim for a neutral spine with gentle support at the small of the back. Feet should rest fully on the floor. If they do not, use a stable footrest so hips are not forced forward. Choose a seat depth that leaves a small gap between the edge of the chair and the back of your knees to avoid pressure on the hamstrings. Position the monitor so the top of the screen is at eye level or slightly below. This keeps the head from jutting forward. Keep the keyboard and mouse close enough that your elbows remain near your sides and your forearms are roughly parallel to the floor. Use armrests to take weight off the shoulders during long tasks, but do not prop your elbows up so the shoulders hunch. For phones and tablets, lift the device to eye level or use a holder and a hands-free option to prevent repetitive neck flexion. Stand with your weight evenly distributed across both feet and your feet about hip width apart. Avoid locking the knees, a slight softening prevents joint strain. Tuck the chin lightly and draw the shoulder blades down and slightly together to open the chest without forcing an exaggerated squeeze. Shift weight periodically from one foot to the other, and place one foot on a low step or footrest for brief relief when standing for prolonged periods. Wear shoes with stable arch support and cushioned soles to reduce stress transmitted up through the spine. At a standing workstation, keep the keyboard at a height that allows the elbows to stay near the body and the wrists neutral. Integrate these tips into routines so good posture becomes automatic. Start the day by checking chair height and screen position. Set a gentle timer or phone reminder to stand and reset your alignment every half hour or so. Before long calls, adjust your device and stand if possible. Pair ergonomic changes with short mobility breaks, arm circles, shoulder blade squeezes, and gentle chin tucks to counteract tightness and reinforce an upright stance. Real-life example, if you answer emails for 20 minutes, stand for 5 while you make a quick phone call and use the time to reset posture. Try 3 practical tweaks right now. Raise or lower your monitor to eye level, add a lumbar cushion or rolled towel, and position your keyboard so your elbows sit comfortably at your sides. Test these changes for a week and notice how your pain levels and energy shift. If persistent pain or marked curvature remains, consult a physical therapist or ergonomic specialist for a personalized setup and targeted exercises. Consistency for long-term pain relief. Muscles remodel in response to behavior, and if posture is allowed to default to a rounded position, the joints, ligaments, and nervous system learn that pattern, which is why pain can persist long after the original trigger fades. After 60, slower tissue repair and age-related changes in muscle mass and spinal mobility make those learned patterns harder to undo without steady input. Brief, intermittent fixes rarely rewire the body. Lasting relief depends on regular, repeated corrective stimuli that retrain both strength and habit. The solution is not a single miracle session but a reliable, repeatable routine that targets the weak and tight tissues maintaining the hunch. Focus on small, consistent actions that address core engagement, mid-back mobility, and scapular stability. Regularity matters more than intensity when starting. Gentle daily work prevents compensatory patterns from reasserting themselves and allows gradual strengthening without flaring pain. This builds resilience in the tissues that tend to fail with age, and it keeps the nervous system comfortable with an upright position. Practical examples help. Incorporate short mobility breaks that open the thoracic spine and lengthen the chest, followed by controlled strengthening for the deep core and the upper back. Use pain-free, modified versions when needed. Seated or supported variations work well for people with limited balance or joint issues. Pair breathing with movement so that inhalation encourages thoracic expansion and exhalation supports core activation. Progression should be gradual. Start with movement quality and control, then increase duration, range, or resistance as those patterns become dependable. Real-life examples include doing a set of gentle thoracic rotations while seated between chores, performing controlled scapular squeezes before standing from a chair, and practicing core bracing during routine tasks like reaching or carrying a light grocery bag. Integration into daily life is the deciding factor. Habit stacking, attaching a brief exercise to an existing daily cue like morning coffee, toothbrushing, or sitting down to read, keeps practice consistent without demanding extra time. Use visual cues, alarms, or a simple checklist to reinforce the new behavior until it becomes automatic. Social accountability helps too. Invite a friend to swap weekly progress messages, or work with a physical therapist who can tailor exercises and troubleshoot setbacks. When pain spikes, scale back intensity and maintain frequency with gentler movements rather than stopping altogether. That preserves the neural learning while protecting healing tissues. Start small and commit to a sustainable pattern. Choose one brief corrective practice you can do daily, pair it with an existing routine, and check in weekly on how movement feels. If pain persists or worsens, consult a clinician for individualized assessment. Consistency, patience, and smart progression will create the long-term improvement that sporadic efforts simply cannot achieve. Before you go, one quick truth: posture after 60 isn't about blame, it's about habits, weakness, and time catching up. The good news is you can change it with small, consistent moves that protect your back and bring back your confidence. Today's essentials in one breath: strengthen your core, open your chest, and retrain your shoulder blades. Start with gentle pelvic tilts and cat-cows for mobility, add bird dogs and seated or band rows for stability, and finish with wall angels and scapular squeezes to pull your shoulders back. Aim for 8-12 reps, 2-3 sets, or a 10-15 minute routine most days. Breathe steadily, stop if you feel sharp pain, and ease into progress. Consistency beats intensity. First get it, mornings are busy, energy dips, aches can be discouraging. Try pairing these exercises with everyday moments: a quick set while your tea steeps, a wall angel between emails, or a bird dog during TV breaks. Little practice, repeated, rewires muscles and relieves pain over weeks, not months. If this helped, tap like and subscribe so you don't miss easy follow-ups. First I'll share chair-friendly versions, gentle progressions, and short guided routines designed for different levels. Comment below with what felt good or what's holding you back. Your questions will shape future videos. Save this video, set a daily reminder, and check back for guided sessions and printable routines coming soon. Small daily changes add up more than a single big effort. Take one step today, and first I'll meet you in the next video to keep building pain-free days and a taller, stronger posture. See you soon.